Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics and one of the common topics and painful topics to the parents, that is physiological neonatal jaundice. This is the most common jaundice in the newborn. The problem with this disease is normally it is mild, it is transient, it is there for few days and it disappears. What happens in some cases is it will be prolonged, it becomes serious in some of the cases. Out of 60% of the neonates who are born after the term, means after full completion of their months, if they are born, 60% of them will have this jaundice. And if they are premature, if they are born before the completion of the months, 80% of the children will have this problem. The main problem we are going to see in this disease is the kid is small and he has to undergo multiple phototherapies. It is painful to the kids and also painful to the both mother and father. And to measure the blood levels of total bilirubin, they will be pricking the vein. The boy will be crying or the girl will be crying, and this cannot be tolerated by the parents. And also, if this becomes serious and there need to be a blood transfusion is also a dangerous process and also a painful process. All this is done, the baby is not recovering, then what happens is there can be a serious form of this disease that is known as kernicterus. Kernicterus means there will be serious damage to the brain, which can lead to hearing impairment, vision impairment, cerebral palsy, where the entire body get paralyzed, and also there can be decreased intelligence and lot of cognitive disabilities because of this seriousness of this disease. Unfortunately, in allopathy, there are only limited treatments, that is either phototherapy or blood transfusion. Other than that, they don't have anything. But coming to homeopathy, homeopathy has the best answer for this. So whether it is in the first stage, second stage, or severe stage, homeopathy offers you very good treatment without a single side effect, and also it is very effective. In this disease, what happens is the liver of the baby is immature. So there are no medicines in any other system of medicine to improve the liver capacity. But in homeopathy, there are specific medicines to improve the liver and to mature the liver. And also there are specific medicines to be given to the kids who are born prematurely. All the complications of the premature birth, including low function of the liver, can be excellently handled by homeopathy. Homeopathy has scope both in preventing the disease, in going into serious complications. And if you are already in the serious complications, you can take the homeopathic treatment so that the duration of phototherapy will be reduced or the frequency of phototherapy reduced. And also you can avoid blood transfusion, and also you can avoid serious damage to the brain. In any cases, it reduces hospitalization or it prevents you from hospitalization or it discharges you quickly from the hospitalization. There are a lot of advantages with homeopathic treatment. We'll completely look into this in this program. What exactly is this physiological neonatal jaundice? Physiological neonatal jaundice is a disease. It occurs in most of the kids. What happens is the liver is immature. The liver is not mature. It cannot synthesize the required enzymes that are responsible for the breakdown of RBC. When the RBC or red blood corpuscles are breakdown in the kid, they has to be eliminated in the body. Major part of this is done by the liver. If the liver is matured, these waste materials which is yellow in color or green in color are not eliminated by the body and they accumulated in the body, and this is known as physiological neonatal jaundice. One more problem we see with this disease is there are a lot of other diseases that can cause jaundice. So not only physiological jaundice, there are other jaundice. There are hundreds of varieties of jaundice, so that can complicate the disease as well. Homeopathy is effective in both physiological jaundice and also any pathological jaundice. Also, homeopathy is very effective. Coming to the signs and symptoms of physiological neonatal jaundice, this jaundice starts after 1 day or 2 days. So it is never on the same day of the birth. If the neonate has jaundice at the time of birth, it is not physiological jaundice, it is pathological jaundice. Physiological jaundice starts after 1 day or 2 days and it peaks. The symptoms are maximum in fifth day or sixth day, and these are completely resolved within 14 days. In some kids, it will not resolve. Those kids needs intervention. And coming to the signs and symptoms, what happens is due to accumulation of bilirubin pigment, there will be yellowness of eyes, yellowness of entire skin, urine will be yellow, stool will be yellowish or greenishness, or stool is mostly green and loose and it is multiple times of stool the children passes. This normally resolves within 14 days. In some kids, it will take more. That's where you need the intervention. When this disease becomes serious, and this is known as kernicterus. In kernicterus, what happens is these bile salts enters into the brain. Once they enter into the brain, It makes the baby dull initially. Later stages, there will be hearing loss, there will be vision loss, there will be entire paralysis of the body, there will be convulsions. Convulsion means fits. And also they can be reduced intelligence, reduced reflexes, all the psychological derangements you can see in this kernicterus. These are permanent damage, you cannot reverse it, but homeopathy has scope in it. Coming to the investigations for physiological neonatal jaundice, the most common one is photometry. With the photometer you can measure the approximate amount of bilirubin present in your blood, but not accurately. If you want to do that accurately, there is an invasive procedure where you draw the blood from the kid and send it to the lab, where you can measure total bilirubin, direct bilirubin, and indirect bilirubin. This has to be repeated multiple times. Maybe it has to be repeated sometimes every 6 hours in serious cases, normally in 12 hours, or normally 24 hours. So it is up to the discretion of the pediatrician or the treating doctor. So this is the accurate method than photometer. Coming to the anatomy and histology, you need to know something about normalcy in a kid, how the normal liver functions, how the normal brain functions. See, when the neonate is born on the first day or second day, all his organs are immature. His liver is immature, not able to function up to the mark. His spleen is immature, and also his brain is immature. His urinary system, where you get urine, is also immature, and also the gastrointestinal tract, where there will be less motility, low amount of waves or low movement in the gastrointestinal system. Because of this, all this toxic material get accumulated in the blood. It is mainly due to the immaturity of systems and also parts of the neonate. Coming to the physiology related to neonatal jaundice, it is very important for you to know the physiology or normal function and structure of all these physiological functions. Normally, in children, what happens is when the children are in a closed environment in the womb, they will not have access to the oxygen directly. Their lungs is not filled with the oxygen. But what they have to do is they have to get the oxygen from the mother's blood. Blood of the fetus should be more efficiently taking oxygen from the mother. For that reason, it develops more RBC. Fetal blood has more RBC or red blood corpuscles than compared to the mother's blood, so that it can efficiently take the oxygen from the mother's blood. It can give it to its own tissues. That's the reason fetal RBC is more than the mother RBC. Next thing is, normally in adult, the lifespan of RBC is 120 days, but in kids or neonates or fetal RBC, the lifespan is only 90 days. After 90 days, it will be destroyed. After 90 days, what happens is this RBC will be destroyed in the spleen or reticuloendothelial system, where from this RBC, hemoglobin is released. Hemoglobin again has two parts, one is heme and one is globin. This heme is highly toxic, it is insoluble in water, it is red in color. What this endoreticulothelial system or the spleen does is it will convert heme into biliverdin. Biliverdin is a green color pigment, it is highly toxic and also it is insoluble in water. After that, spleen again converts this biliverdin into bilirubin, which is less toxic and it is also insoluble in water. Once it is converted into bilirubin, it comes out of the reticuloendothelial system or spleen and it attaches itself with the plasma proteins. Once it attaches with the plasma proteins, it is carried to the liver. It is carried to the liver of the mother in the baby. So what happens here is mother's liver is responsible for eliminating this toxic material from mother's urine and mother's stool. It comes out. But what happens immediately after the birth of the kid? When the kid is born, it is completely separated from its mother. As the baby's liver is immature, it doesn't have all the enzymes required to survive itself. So there will be a problem here. The problem is the unconjugated bilirubin has to be conjugated by liver so that it becomes less toxic and water soluble, and it has to be eliminated from urine and stool of the kid. In newborn babies, the unconjugated bilirubin starts rising from second day or third day. It goes to peak on fifth day or sixth day. Within 14 days, it becomes normal. You have to simply remember that liver is immature. That's the reason it cannot eliminate the toxins out of the body. That's the reason these toxins get accumulated in the blood, and this is taken up by the skin and eyes. That's the reason you see yellowness in the newborn baby. Coming to the causes of neonatal physiological jaundice, the important one is immature liver. As the baby is born, liver is not mature, it is not fully active. The enzymes responsible for detoxification are not fully formed. That's the reason these toxic materials become increased in the blood. Next one is when the baby is born immaturely before the completion of the months. It is also one of the risk factors because their liver is more immature compared to the mature delivery. Normally, the lifespan of RBC is only 90 days in kids. That's the reason after 90 days, they will be destroyed. As the RBC has low lifespan, more RBC will be frequently destroyed in the spleen and releases more toxic material that cannot be eliminated from the kid's body. Compared to adults, kids will have more RBC because they do not have direct access to the oxygen in the air. They have to take the oxygen which is there in the mother's blood. It means their circulatory system or their oxygen diffusion system should be more potent than their mother. That's the reason the number of RBC or the red blood corpuscles present in the fetus are more than compared to the mother's blood, so that they can be efficient. All these causes leads to higher RBC in kids and also with low lifespan and low maturity of the liver. That's the reason all these toxins get accumulated in the eyes and in the skin. Coming to the pathology of physiological neonatal jaundice, or what exactly happens in the body and liver of the newborn, is very important for you to know. Once the RBC or red blood corpuscles are destroyed by endoreticulothelial system or spleen, this heme is converted into biliverdin. Biliverdin is again converted into bilirubin. This bilirubin is transported to liver. This is unconjugated form, but the liver has to conjugate this, make it less toxic, water soluble, and it has to eliminate through motion and through urine. What happens is liver is immature in kids. It is not fully functional. It doesn't have all the enzymes required for conversion. That's the reason it becomes inefficient, and the toxic material, that is unconjugated bilirubin, gets accumulated in the blood of the kid. That's the reason you see yellowness in the face, yellowness in the entire body, and also yellowness in the eyes. That's the reason this unconjugated bilirubin gets accumulated in the body, and this unconjugated bilirubin, which is present in blood, is taken up by the collagen. Collagen is the most common protein present in entire body. It is present in eyes, sclera. When it takes it, it becomes yellow. This collagen is also present in the skin. That's the reason when this collagen takes up this unconjugated bilirubin, it becomes yellow. In serious cases where bilirubin reaches over 20 mg per dl of blood, what happens is this bilirubin crosses blood-brain barrier and enters into the brain, and it causes serious damage to the brain. Because of this, permanent hearing loss, permanent vision loss, there can be seizures, there can be less in intelligence, and also there can be complete paralysis of the body. Lot of permanent damage that can occur due to higher levels of unconjugated bilirubin in the blood that crosses blood-brain barrier and enters into the brain. Coming to the conventional treatment of physiological neonatal jaundice or the jaundice in newborn, the conventional treatment means English treatment or Western treatment. The treatment you go and take with a pediatrician or a corporate hospital or a small hospital nearby you is known as conventional treatment. In conventional treatment, there are only two options available. One is phototherapy, next one is blood transfusion. So phototherapy is very important. You should not be neglecting phototherapy. So phototherapy has very greater impact in reducing this disease. In phototherapy, what happens is your kid's skin will be exposed to the blue lights. When it is exposed to the blue light, the toxic unconjugated bilirubin is broken down into less toxic water soluble material, and it is eliminated through feces or through motion or through urination. It is very important to have phototherapy, and there are two types of phototherapy available. One is Billy lights and one is Billy blankets. In Billy lights, what happens is the light will be put from above onto your kid, so that the high toxic material is converted into less toxic material and it is eliminated. In this, what you have to do is you have to wear the mask so that eye is not exposed to the blue light, and also there are some precautions you have to take here. First one is you should not be applying oils to the kid. When you apply oils or lotions or creams, they become heated and it will burn the skin of the kids. That's the reason you should not be applying it. Next one is temperature. You have to monitor the temperature of the kid. If the temperature is going above, you have to reduce the temperature or it will dehydrate the kid. The next thing you have to do when the kid is in phototherapy is to observe for the signs of dehydration. If there is any severe dehydration, you have to stop and hydrate the baby and then take it forward. One more thing you have to do is you have to monitor the blood levels of total bilirubin, both conjugated and conjugated regularly. Normally, it should be for 6 hours or 12 hours or 24 hours as per the severity of the disease. And also important thing you have to do here is you have to regularly feed the baby. When you regularly feed the baby, so lot of motion is passed out. Along with the motion, so all this toxic material comes out. Normally the stool will be green or yellow or mucus. There will be multiple frequent stools. It is very good and you should not be panicking if it has these kinds of stools, and it is very good that The intestine is working properly and it is pushing out all the waste materials from the body. Next option is belly blankets. In belly blankets, we will have the blankets where it will have blue light. You have to just wrap the baby in the blue lights and it will take care. And the most common one is belly lights, not belly blankets. Belly blankets are not available at all the places. If this is not possible, if the blood values are not coming down and the icterus is not settling down, you have to go with the blood transfusion. If you go with the blood transfusion, there will be a lot of side effects. But still, in some cases where the pathology is gross and when you are not able to control the jaundice with phototherapy, this is the option they have. The option is replacing the blood, taking the blood from other person and pushing the blood into the baby. This is also a painful process both to the kid and also to the parents, and it is also a dangerous process. Other than these two, there are no medicines with allopathic doctors to make the liver mature so that the liver functions efficiently, and there are no medicines with them once the disease is there. When the unconjugated bilirubin crosses blood-brain barrier, it enters the brain and it damages the brain. They don't have any medicines to recover this. But coming to the homeopathic treatment is the best treatment because homeopathy medicines are specific. Homeopathy medicines can act on the liver so that it will mature the liver, it will improve the liver enzymes, and also homeopathic medicines can decrease the damage caused to the brain or permanent damage, it can reverse it. So homeopathy can be used both in prevention, in going into complications, and also if you are already in the complication, in any stage of the complication, even in kernicterus where say there is serious damage to the brain, you can use homeopathic medicines. There are specific medicines in homeopathy to mature the liver, and also specific medicines in homeopathy when the baby is premature and the liver is still immature. So you have medicines for premature babies as well in homeopathy. Homeopathy has several advantages. Homeopathy is safe. Even without single side effect, you can treat the baby with homeopathy. And also in any case, so it is a mild form or a severe form, homeopathy can help you. How homeopathy can help you? First of all, homeopathy can help you in going into phototherapy. So it will prevent you from phototherapy, or it will reduce the duration of phototherapy, or it will reduce the frequency of phototherapy. It can reduce you from going into hospitalization or blood transfusion. It will reduce the stay in hospital. It will prevent you from going into hospital. Even in advanced cases where this bilirubin has crossed the blood-brain barrier and the bilirubin has entered into your brain, there is very good scope for homeopathy. Even at later stages, maybe you have seen this video now and your kid is already 5 or 6 years old and he is having lot of complications because of this kernicterus, serious form of this neonatal jaundice. You can take homeopathic treatment. Normally kids respond very well in any stage of kernicterus or any stage of physiological jaundice. Finally, you have to remember homeopathy helps your kids in any stage, initial stage, middle stage, or later stage. Even after 10 years, homeopathy can help you. There is no need for you to fear that this treatment may have side effects. There will not be even a single side effect. Coming to the precautions for physiological neonatal jaundice or the jaundice in newborn, it is very important for you to understand few important precautions. You have to be very careful, or the parent has to be concerned when the blood levels of total bilirubin raises above 50 mg per dl. It is an alarming situation, and you have to be very careful. You have to be monitoring very closely. Important thing you have to do is you have to feed the baby multiple times. When you feed the baby multiple times, so there will be lot of stool formation and lot of activity in the intestine and lot of stool coming out. When the stool comes out, it will be green, it will be slimy, it will be loose stools and multiple stools. This helps in elimination of these toxic materials from the body. It is eliminated both from stool and also through urination. If the kid is actively feeding and actively passing stool, no need to worry about it. This is an important sign and also a healthy sign. You have to expose your baby to sunlight, maybe half an hour in the morning, half an hour in the evening. You have to expose your baby to the sunlight. When you expose the skin of your baby to the sunlight, all these toxic material which is unconjugated bilirubin accumulated in the eyes and in the skin, it will be broken down into less toxic material and also water soluble material, and it is eliminated from stool or motion. It is also eliminated from urine. That's the reason you have to importantly expose the skin of the baby to sunlight morning and evening 2 times. The next important thing is the differential diagnosis. The differential diagnosis is, so it is not only the physiological jaundice, there are other forms of jaundice. There are serious forms of jaundice known as pathological jaundice. There are varieties or hundreds of diseases that can cause pathological jaundice. You have to identify what type of jaundice it is and you have to concern an expert in it and take the treatment. Do not take it lightly. it is a serious condition. These are the common precautions you have to take for physiological neonatal jaundice or the jaundice in the newborn. Coming to the prognosis, what happens when you don't take care of this disease or when you neglect this disease? So when you neglect this disease, there will be a lot of serious complications. In most of the kids, it is going to resolve, but in some of the kids, it becomes serious. When the total bilirubin level crosses more than 20 mg per dl, this condition is known as kernicterus. In kernicterus, this bilirubin enters into your brain and it will cause permanent damage to the brain of your kid. It will cause permanent hearing loss, permanent vision loss. There can be seizures or there can be fits in the kid. There can be complete paralysis of the body. There can be reduced intelligence. These are permanent damages that can happen to your kid. So do not neglect this disease. Take care of this disease with a expert homeopathic doctor. How to identify kernicterus is very simple. In neonatal jaundice, when the baby becomes dull and he is more yellow than compared to normal kids, then you have to suspect kernicterus. Finally, we are Fidicus Homeopathy. Fidicus Homeopathy has multiple branches across the world. You can take two types of treatment for neonatal jaundice. You can approach us directly. You can bring the kid to us and we will examine the kid and start the treatment. Or else you can take online treatment. In online treatment, you can have both audio call and video call. In video call, we will see your kid and we will ship the medicines to your doorsteps wherever you are in this world. We are shipping the medicines entire world. We have patients in US, UK, France, Japan, Germany. So we are treating the kids across the world. So finally, homeopathy is safe, homeopathy is effective, homeopathy is timely in physiological neonatal jaundice. Not only in physiological neonatal jaundice, in other forms of jaundice where it is pathological, it has a lot of implications in the kids. That's the reason consider homeopathy for your kid, whether he is right now suffering from neonatal jaundice or the complications of neonatal jaundice, or the kids when they are grown they still have the complications of jaundice. You can approach us and take the treatment. With us, you have highest success rate for neonatal jaundice compared to any other homeopathic doctor or the corporate homeopathic hospital or clinics in the world. So Fidicus Homeopathy is the best answer for your neonatal jaundice. Thank you.
Fidicus Homeopathy.